Hi everybody, Rachel Bodie-Leffelholtz here, and today I'll be discussing the dialogue or the report that I would give to the ER provider when the primary care provider, has determined an urgent and emergent situation in my clinic that needs referral to the ER. Hi, Dr. Williams. This is Rachel, nurse practitioner here over at Grant Regional. I'm going to be sending you a 67-year-old male who originally presented to my office today with complaints of blood sugar issues. However, when he arrived at the clinic this morning, he was noted to have some chest heaviness, to be pale, diaphoretic, and having some palpitations. The onset of this chest heaviness began at 11 p.m. last night. The discomfort woke him out of his sleep. He denies ever having similar pain like this before. No new traumas, no new foods, nothing aggravating factors that he can pinpoint. An EKG was done at 9:08 in the office, which showed sinus tach and no significant ST changes from the previous EKG completed in my office about 8 months ago. He believes that the chest heaviness has gotten worse throughout the day. Activity has definitely been making the pain and the discomfort worse, and he is now starting to become short of breath with this activity as well, feeling he has to cough and just cannot catch his breath. Rest, however, has allowed the pain to improve slightly. He describes the pain as a heaviness, like something sitting or continuously pushing in the middle of his chest, and it feels like a sharp pain to the back, just directly through his back when he takes a deep breath. Originally, the pain did not radiate anywhere, but since it has begun to be more progressive, he now notes that it started in the center of his chest, and he can feel it through his back now as well. Currently rating the pain 7 out of 10 with activity, 5 out of 10 with rest. And since the pain began at 11 p.m. last night, he has noted that it has gotten slightly worse and is more consistent. Upon physical exam, the patient is pale, he's diaphoretic, he appears short of breath. His heart rate is 122, blood pressure 132/70, respirations 24 and labored. His O2 is 91% on room air. He was then placed on 2 liters of nasal cannula, and his O2 was brought back up to 97%. He did report that this helped with his shortness of breath slightly. His point of care glucose in office was 153. In the office, he was also given 325 milligrams of chewable aspirin, along with the 2 liters of nasal cannula oxygen for prophylaxis and comfort. He does have a couple allergies. Doxycycline, metformin lead to GI upset. Betrix leads to shortness of breath, and glipramide led to a rash. His medication list was updated and is currently being faxed to your facility, but it includes simvastatin, enalapril, tamsulosin, and Lantus, which was last taken around 8 a.m. this morning. Past medical history is positive for hyperlipidemia, type 2 diabetes, hypertension, iron deficiency, anemia, and he is currently 1 week status post right inguinal hernia repair with Dr. Pertu. His last oral intake was 6:30 this morning. It consisted of orange juice and toast. And the events leading up to this this chest heaviness, this clinic visit today included he's been having some uncontrolled blood sugar issues, and then today presented with this chest heaviness that started at 11 p.m. and has been getting progressively worse since then. His current symptoms include his fatigue, his pallor, his diaphoretic, his increased work of breathing, his hypoxia, his tachycardia. The physical exam performed here in the clinic revealed the vital signs and the assessments that I have previously provided to you. The only diagnostics done today were the EKG. Unfortunately, we were not able to get IV access, and our lab would be unable to be any benefit to you at this time. I am concerned for a couple different things, one of them being a cardiac event due to the angina that he is experiencing. I also come to question PE due to his recent surgery and hypoxemia. Treatments and medications have been provided today, include the aspirin and the EKG. Currently, the patient is stable vital signs wise. However, I do believe transfer is appropriate for this patient so that he may have a further workup for possible PE and or cardiac events with his presenting signs and symptoms. Any other recommendations or current orders, Dr. Williams? Okay. EMS is en route. They're pulling in currently, so they should be at your door. I would guess in like 5 to 7 minutes. I will make sure that the notes from this office visit are faxed over to your clinic, as well as a med rec and his past medical history. Any other questions, feel free to give me a call here back at the clinic, and if you have time later in the day, a update would be greatly appreciated. Thank you for taking care of this patient with me, Dr. Williams. Have a great day.